Autism is a neurodevelopmental disorder characterized by impaired social interaction, verbal and nonverbal communication, and restricted and repetitive behavior. Parents usually notice signs in the first 2 years of their child's life. These signs often develop gradually, though some children with autism reach the developmental milestones at a normal pace and then regress. The diagnostic criteria require that symptoms become apparent in early childhood, typically before age 3. While autism is highly heritable, researchers suspect both environmental and genetic factors as causes. In rare cases, autism is strongly associated with a gene that cause birth defects. Controversies surround other proposed environmental causes. For example, the vaccine hypotheses have been disproven. Autism affects information processing in the brain by altering how nerve cells and the synapses connect and organize. How this occurs is not well understood. In the DSM-V, it is one of 3 recognized disorders in the autism spectrum, the other 2 being Asperger's syndrome, which lacks delays in cognitive development and language, and pervasive developmental disorder, not otherwise specified, which is diagnosed when the full set of criteria for autism or Asperger's syndrome are not met. Early speech or behavioral interventions can help children with autism gain self-care, social and communication skills. Although there is no known cure, there have been reported cases of children who recovered. Not many children with autism live independently after reaching adulthood, though some become successful. An autistic culture has developed, with some individuals seeking a cure and others believing autism should be accepted as a difference and not treated as a disorder. Globally, autism is estimated to affect 21.7 million people as of 2013. As of 2010, the number of people affected is estimated at about 1 to 2 per 1,000 worldwide. It occurs 4 to 5 times more often in boys than girls. About 1.5% of children in the United States are diagnosed with ASD as of 2014, a 30% increase from 1 in 88 in 2012. The rate of autism among adults aged 18 years and over in the United Kingdom is 1.1%. The number of people diagnosed has been increasing dramatically since the 1980s, partly due to changes in diagnostic practice and government-subsidized financial incentives for named diagnoses. The question of whether actual rates have increased is unresolved. Characteristics. Autism is a highly variable neurodevelopmental disorder that first appears during infancy or childhood, and generally follows a steady course without remission. People with autism may be severely impaired in some respects but normal, or even superior, in others. Overt symptoms gradually begin after the age of 6 months, become established by age 2 or 3 years, and tend to continue through adulthood, although often in more muted form. It is distinguished not by a single symptom, but by a characteristic triad of symptoms: impairments in social interaction, impairments in communication, and restricted interests and repetitive behavior. Other aspects, such as atypical eating, are also common but are not essential for diagnosis. Autism's individual symptoms occur in the general population and appear not to associate highly, without a sharp line separating pathologically severe from common traits. Social development. Social deficits distinguish autism and the related autism spectrum disorders from other developmental disorders. People with autism have social impairments and often lack the intuition about others that many people take for granted. Noted autistic Temple Grandin described her inability to understand the social communication of neurotypicals, or people with normal neural development, as leaving her feeling like an anthropologist on Mars. Unusual social development becomes apparent early in childhood. Autistic infants show less attention to social stimuli, smile and look at others less often, and respond less to their own name. Autistic toddlers differ more strikingly from social norms. For example, they have less eye contact and turn-taking, and do not have the ability to use simple movements to express themselves, such as pointing at things. 3 to 5-year-old children with autism are less likely to exhibit social understanding, approach others spontaneously, imitate and respond to emotions, communicate non-verbally, and take turns with others. However, they do form attachments to the primary caregivers. Most children with autism display moderately less attachment security than neurotypical children, although this difference disappears in children with higher mental development or less severe ASD. Older children and adults with ASD perform worse on tests of face and emotion recognition, although this may be partly due to a lower ability to define a person's own emotions. Children with high-functioning autism suffer from more intense and frequent loneliness compared to non-autistic peers. Despite the common belief that children with autism prefer to be alone, making and maintaining friendships often proves to be difficult for those with autism. For them, the quality of friendships, not the number of friends, predicts how lonely they feel. Functional friendships, such as those resulting in invitations to parties, may affect the quality of life more deeply. There are many anecdotal reports, but few systematic studies, of aggression and violence in individuals with ASD. The limited data suggest that, in children with intellectual disability, autism is associated with aggression, destruction of property, and tantrums. Communication: about a third to a half of individuals with autism do not develop enough natural speech to meet the daily communication needs. Differences in communication may be present from the first year of life, and may include delayed onset of babbling, unusual gestures, diminished responsiveness, and vocal patterns that are not synchronized with the caregiver. In the second and third years, children with autism have less frequent and less diverse babbling, consonants, words, and word combinations. The gestures are less often integrated with words. Children with autism are less likely to make requests or share experiences, and are more likely to simply repeat others' words or reverse pronouns. Joint attention seems to be necessary for functional speech, and deficits in joint attention seem to distinguish infants with ASD. For example, they may look at a pointing hand instead of the pointed-at object, and they consistently fail to point at objects in order to comment on or share an experience. Children with autism may have difficulty with imaginative play and with developing symbols into language. In a pair of studies, high-functioning children with autism aged 8 to 15 performed equally well as, and adults better than, individually matched controls at basic language tasks involving vocabulary and spelling. Both autistic groups performed worse than controls at complex language tasks such as figurative language, comprehension, and inference, as people are often sized up initially from the basic language skills. These studies suggest that people speaking to autistic individuals are more likely to overestimate what their audience comprehends. Repetitive behavior. Autistic individuals display many forms of repetitive or restricted behavior, which the Repetitive Behavior Scale Revised categorizes as follows: stereotyped behaviors, repetitive movements, such as hand flapping, head rolling, or body rocking. Compulsive behaviors, time-consuming behaviors intended to reduce anxiety that an individual feels compelled to perform repeatedly or according to rigid rules, such as placing objects in a specific order, checking things, or hand-washing. Sameness is resistance to change, for example, insisting that the furniture not be moved or refusing to be interrupted. Ritualistic behavior involves an unvarying pattern of daily activities, such as an unchanging menu or dressing ritual. This is closely associated with sameness, and an independent validation has suggested combining the two factors. Restricted behavior is limited in focus, interest, or activity, such as preoccupation with a single television program, toy, game. Self-injury includes movements that injure or can injure the person, such as eye-poking, skin-picking, hand-biting, and head-banging. No single repetitive or self-injurious behavior seems to be specific to autism, but autism appears to have an elevated pattern of occurrence and severity of these behaviors. Other symptoms. Autistic individuals may have symptoms that are independent of the diagnosis, but that can affect the individual and the family. An estimated 0.5% to 10% of individuals with ASD show unusual abilities, ranging from splinter skills such as the memorization of trivia to the extraordinarily rare talents of prodigious autistic savants. Many individuals with ASD show superior skills in perception and attention relative to the general population. Sensory abnormalities are found in over 90% of those with autism, and are considered core features by some, although there is no good evidence that sensory symptoms differentiate autism from other developmental disorders. Differences are greater for under-responsivity than for over-responsivity or for sensation-seeking. An estimated 60% to 80% of autistic people have motor signs that include poor muscle tone, poor motor planning, and toe walking. Deficits in motor coordination are pervasive across ASD and are greater in autism proper. Unusual eating behavior occurs in about 3/4 of children with ASD, to the extent that it was formerly a diagnostic indicator. Selectivity is the most common problem, although eating rituals and food refusal also occur. This does not appear to result in malnutrition, although some children with autism also have gastrointestinal symptoms. There is a lack of published rigorous data to support the theory that children with autism have more different gastrointestinal symptoms than usual. Studies report conflicting results, and the relationship between gastrointestinal problems and ASD is unclear. Parents of children with ASD have higher levels of stress. Siblings of children with ASD report greater admiration of and less conflict with the affected sibling than siblings of unaffected children, and were similar to siblings of children with Down syndrome in these aspects of the sibling relationship. However, they reported lower levels of closeness and intimacy than siblings of children with Down syndrome. Siblings of individuals with ASD have greater risk of negative well-being and poorer sibling relationships as adults. Causes. It has long been presumed that there is a common cause at the genetic, cognitive, and neural levels for autism's characteristic triad of symptoms. However, there is increasing suspicion that autism is instead a complex disorder whose core aspects have distinct causes that often co-occur. Autism has a strong genetic basis, although the genetics of autism are complex, and it is unclear whether ASD is explained more by rare mutations with major effects, or by rare multi-gene interactions of common genetic variants. Complexity arises due to interactions among multiple genes, the environment, and epigenetic factors which do not change DNA sequencing but are heritable and influence gene expression. Many genes have been associated with autism through sequencing the genomes of affected individuals and the parents. Studies of twins suggest that heritability is 0.7 for autism and as high as 0.9 for ASD, and siblings of those with autism are about 25 times more likely to be autistic than the general population. However, most of the mutations that increase autism risk have not been identified. Typically, autism cannot be traced to a Mendelian mutation or to a single chromosome abnormality, and none of the genetic syndromes associated with ASDs have been shown to selectively cause ASD. Numerous candidate genes have been located, with only small effects attributable to any particular gene. Most loci individually explain less than 1% of cases of autism. A large number of autistic individuals with unaffected family members may result from spontaneous structural variation, such as deletions, duplications, or inversions in genetic material during meiosis. Hence, a substantial fraction of autism cases may be traceable to genetic causes that are highly heritable but not inherited. That is, the mutation that causes the autism is not present in the parental genome. Several lines of evidence point to synaptic dysfunction as a cause of autism. Some rare mutations may lead to autism by disrupting some synaptic pathways, such as those involved with cell adhesion. Gene replacement studies in mice suggest that autistic symptoms are closely related to later developmental steps that depend on activity in synapses, and on activity-dependent changes. All known teratogens related to the risk of autism appear to act during the first 8 weeks from conception, and though this does not exclude the possibility that autism can be initiated or affected later, there is strong evidence that autism arises very early in development. Exposure to air pollution during pregnancy, especially heavy metals and particulates, may increase the risk of autism. Environmental factors that have been claimed to contribute to or exacerbate autism include certain foods, infectious diseases, solvents, diesel exhaust, PCBs, phthalates and phenols used in plastic products, pesticides, brominated flame retardants, alcohol, smoking, illicit drugs, the vaccines, and prenatal stress, but no evidence has been found for these claims, and some such as the MMR vaccine have been completely disproven. Parents may first become aware of autistic symptoms in the child around the time of a routine vaccination. This has led to unsupported theories blaming vaccine overload, a vaccine preservative, or the MMR vaccine for causing autism. The latter theory was supported by a litigation-funded study that has since been shown to have been an elaborate fraud. Although these theories lack convincing scientific evidence and are biologically implausible, parental concern about a potential vaccine link with autism has led to lower rates of childhood immunizations. Outbreaks of previously controlled childhood diseases in some countries, and the preventable deaths of several children.